the rain showers were, and just the cloud formations and everything were really interesting on the way home.
Yeah, we got pummeled by rain on the way back. Two really, really hard rains.
Yeah, mine was, I mean, I know you were going more southwest and I was going due west. With that rain and the way the sun was shining in, was sometimes a challenge.
It was.
What did you think of the conference?
I thought it was good. I'm glad that they're giving a lot more attention to social determinants, such as housing for the homeless, and some of the other areas. I think that you know, providers and the ACHs are in their programming are moving more and more towards that. There's more clarity about how to bring that out.
Yeah, but I think I expressed some frustration when we were talking about community health workers and kind of the lack of financial support to expand. I mean, I would just call it kind of generic patient engagement strategies around social determinants of health and lifestyle and, you know. So I expressed some frustration that we tend to be stuck in our traditional healthcare models, and we're really not doing enough to expand outside of that. Anyways.
Interesting.
So Dan, did you want to get started with the meeting? I noticed that we had included the December minutes, but I would consider the meeting that we had with the Lens, I think that was in, I want to say July, when we had the first presentation on the Sentinel Network survey results, as the last meeting that we had with the workforce group. It was a combined Lynn workforce meeting. So
Yeah.
Lauren's looking at if she can find those minutes.
Oh, okay. All right. So are we wanting to wait to show the, I agree with you, Carol. So do we have a number of people on, or I'm not, let me see.
We do. I think we can get started.
Okay. All right. Great. Well, welcome everyone to the GCACH Workforce Committee. Thank you for attending. And I'm Dan Ferguson with the Allied Health Center of Excellence at Yakima Valley College, representing the community college system, and also the on the ACH board representing workforce. Let's go ahead and do introductions, and then we can look at approving those minutes. So let's, let me see. Sandra, could you go ahead and introduce yourself?
Hi, this is Sandra Suarez from Yakima Valley Farm Workers Clinic, representing FQHCs on the governing board.
Great. And Debbie?
Hi, everyone. It's Debbie Spink from the Department of Health with the Community Health Worker Training Program.
Oh, awesome. And then who else do we have on the phone?
We have Aisha Hewitt.
This is Aisha. I'm a regional labor economist with Employment Security Department for State of Washington. And I represent just data collection and labor market information.
Oh, nice. Very good here on this call. And then it looks like we have a number of staff at the Greater Columbia.
So let's start with Becky. Becky Kwon, our Director of Finance and Contracts for GCACH.
Wes Lucky, Deputy Director.
Carol Moser, Executive Director.
Chuck Eaton, volunteer with Blue Mountain Heart to Heart.
Chelsea Chapman, administrative assistant. Lauren Johnson, marketing manager, and I'd like to introduce Chelsea. She just joined us on Monday. She started as our administrative assistant, so she will be organizing meetings and helping take minutes.
Yay.
Good to be here.
Great, welcome.
Thank you.
Anybody else in the room there at the ACH?
No, that's it.
All right, and
Our head shaking no.
and do we have anybody else on the phone that we may have missed? Sound like it.
Looks like that's it, Dan.
All right. So do we find those meeting minutes from the meeting with the lens?
I have not located them yet. If it's okay, maybe we can just recap the meeting and then I can send it out to the group this afternoon once I locate them.
Right. So, Dan, as I recall, we had put you on task to present to the workforce and the LIN leaders kind of the results of the LIN or the Sentinel Network survey, which was also a repeat. It was repeated in at our last meeting for the Leadership Council meeting. But in our Leadership Council meeting, we also had other members of the community. We had Sandra Haynes and Les Stolnicker just walked in. Thank you, Les. And the Chancellor Rebecca Woods from CBC and Sarah Williams from WSU was also there to talk about workforce issues. The LIN meeting and the workforce meeting was basically because we wanted the LINs to understand what the community needs were as identified through the Sentinel Network. And so that's why we had that joint meeting with them.
Great. So do we need to approve the minutes from, I mean, we don't have minutes in front of us. Do we need to approve these previous minutes?
Yes, we do.
Okay. Have people had a chance to review them? Hopefully.
Dan, do we have many people who were at that meeting on the call?
That is a very good question, Sandra.
Yeah, Chuck?
Because I was there, but I don't think I was there.
Sandra?
I think I was there too.
Yeah.
Okay, so there were a number of people that called in. It says that Sandra was present. Do we have a motion to accept those minutes?
I can make a motion.
Okay, is there a second?
This is Sandra, I'll second.
All right. Okay, so we had a motion from someone.
Aisha.
Okay, Aisha, to approve the minutes. Do we have a second?
This is Sandra, I'll second.
Thank you. So Sandra has made the second. Are we required to have a quorum in this committee?
Well, let's look at the charter.
Oh,
Hello.
hi.
Yes. According to the charter, at least 75% of all members of the workforce committee must be present in person or electronically to the extent electronic participation is permitted.
I guess the question is, and feel free to support, help guide this. We need more people here to approve the minutes.
I think we probably do, Dan, and so I think that's one of the things that when we go through the workforce charter, it will be helpful to discuss that because the composition of the work group has been kind of a moving target. because we've had very kind of sporadic meetings. They haven't been on a regular schedule. That's probably something that we need to decide.
Carol,
Yes?
it would be really helpful to know who all is part of the committee and how many members are part of the committee.
So Lauren is prepared to bring up the roster.
It's on the screen.
Okay, so it sounds like we need to postpone approve the previous meeting. And
Okay.
we should go right into discussing, looks like the next item is on the committee charter, is that correct?
So Dan, I don't know if you have your screen in front of you, but we have a roster, the existing roster of the workforce committee members. And present today are Aisha, Chuck, yourself, Debbie, Heidi Snyder couldn't attend this morning. They had something at CBC. John Christensen is here, just walked in, and Les Stalnecker. And we are missing, and Sandra is also on the line. We are missing quite a few other people, however, that have expressed interest in this committee.
So do we have a problem with expressed interest in actually on the committee? Because it seems like, and maybe this is a discussion for the charter, for the work group, that we need to have some way of establishing who actually is going to really be on the committee.
I agree.
Not that I want to kick anyone out, but it'll be hard to do anything when we have a need to have 75% present to do any work.
And right, and do we have to have such a large committee if we can have them participate?
So maybe one suggestion, maybe I should just ask, so do you have any guidance or suggestions about how to move forward with this in terms of maybe, I guess as I'm saying this, I'm thinking we need to maybe revisit this list and then maybe think about, are we wanting to come up with a core 8 to 10 people who can commit to a process, and then it sounds like this larger, broader group might be more of an advisory committee or a group to help to inform the work of the committee. But let me know what your thoughts are.
And it might be just this be one of these things because we don't meet very often, that maybe it's just because of the lack of consistency, people honestly couldn't participate during this time. But I know Lauren sent out a doodle poll, and I don't know what the response rate compared to the list rate of that was, but maybe we need to go through a process of kind of having an established, here's our meeting schedule, so that people really can commit, and then just reaffirm who does and does not want to participate in this work group.
So the bylaws we have here, or whatever they're called,
The charter.
says that members and chair of workforce committee are appointed and report to the board of directors or to their respective ACH governing bodies, and I'm not sure what respective ACH governing body means. And then if there's a vacancy, it's filled by leadership or a couple other ors in there. So not that I'm trying to slow anything down, but do we just make a recommendation to the board for what we would want for membership? Perhaps there is a executive membership, or I don't know what you would call it, but something where there's a few people that are very committed, maybe 10, and then everybody is always welcome and will be included. But it's that 10, the group of 10 who need to be there for the quorum or something like that. It's a suggestion, an idea.
So you would suggest that maybe if there was a core group of 10 with 75 of that 10 showing up to the a regularly scheduled workforce committee, that might be a better strategy.
Yeah, I think so. And I just pulled 10 out of the sky. I have no idea. How many people are actually here? What's the number?
So it looks like Rhonda and Patrick joined us.
Okay, so we have a quorum. We're talking about.
Yeah, so this is Patrick. I'm listening in.
Hi, Patrick.
Rhonda's here.
So,
Hello.
And it might need to be 12 or something. It probably should be based on the people that we want to make sure are in it to be the core, as opposed to, because it could be 10 of us that all work in one place, and that wouldn't be rounded.
So, can I make a suggestion, Dan? I think, why don't we go right to the charter? And this is the reason I brought the charter up for today's discussion, is because I think now we have reached a point where if we're going to fund for these certain projects, we really need to finalize who's actually going to be on the workforce committee. And there were some suggestions made in the charter as to who should be, involved. And so that's why originally we had invited Aisha Schulich as a regional economist and Patrick Jones, who also is an economist from Eastern Washington, and some people from the workforce world that were very interested in doing this. So maybe including educational institutions. So maybe we could take a look at the charter and see whether or not we agree still with the charter that was developed way back when. I think this is part of our certification process, and so we haven't looked at the charter for a really, really long time, and I don't know if it's still relevant or not, but maybe that would be a good place to spend a few minutes to say how we work to go.
Okay, sounds good, Carol. Can you go ahead and kind of walk us through that then?
Sure. So Lauren has the charter up on the screen, but let's all agree, first of all, is the charge of this committee what is written, which is the Greater Columbia Accountable Community Health Workforce Committee is responsible for the development, implementation, and oversight of a comprehensive workforce strategy to ensure that the GCACH provider system retains, hires, and trains the staff necessary to support the successful implementation of the district projects being implemented. Have any comments on that lengthy statement?
Chuck Eaton, I have a comment. My recollection is that we started out with considerable discussion about a transformed healthcare system, one that would look quite different than the one we have right now. And many of the documents reflect a transformed system. It seems to me that the Workforce Committee Charter does not reflect that the task of the Workforce Committee is to prepare for that transformed system. It seems to me that the work that's gone on so far and what the scope looks like is reflective of what has been. And that includes the Sentinel Network survey, which basically asked providers, who do you need? Which means that the providers look back and say, well, if we had had so-and-so and so-and-so, we could have done such and such. But it's always looking back. And my concern is if the system is going to be transformed, we need to plan a workforce for the future.
Yeah, Chuck, let me just kind of respond to that. So within the Sentinel network, and the Sentinel network does provide information that in fact just reports data that they're collecting from providers. But you do make a good point about the kind of the area of the focus of the area of the focus is really on kind of traditional careers. But I don't know that, I mean, and I admire your interest in kind of looking at kind of going towards what's happening with transformation. But really the workforce committee receives its guidance from the board and from the leadership council. I don't know if it's up to the workforce committee to be redirecting its focus towards that healthcare transformation when the rest of the we haven't necessarily received that direction from the broader ACH work.
So this is Rhonda. I'd like to comment on that. I think as a provider and somebody who completes the Sentinel Network survey, I know that we certainly have put information in there on people we hope to hire, not necessarily people that we've lost and need more of. So I think it does allow for a futuristic. We were looking for psychologists before we had psychologists, so we wanted to hire psychologists, or clinical pharmacists is another that we put in there before we wanted to hire them. And I think the other thing is this, in the charge, it talks about supporting successful implementation of the DISRIP, which I think does speak to practice transformation. I mean, I think that's sort of, as we've talked about, how do we implement practice transformation, that for many organizations that does require new staffing and new people, and how to use existing people and with new skills. How we transform what we're doing, and sometimes it's with new people, but sometimes it's with new skill sets of the people that we have.
So would it help if we spelled out DISRIP instead of put it in as initials, so that we could perhaps see that this is a forward-looking project group? What does that stand for?
Delivery System Reform Incentive Payment.
So it's looking at how we are. I have no clue. Yeah, and that's what I'm saying. So I occasionally find that we end up using our own little language because we talk about stuff and then we do not include others. We need to.
Easily done. My apologies.
Yeah. No, that's fine. Delivery System Reform
Incentive or program.
Payment.
So I guess I want to concur or just reaffirm what Rhonda just said in regards to what the Sentinel asked for. There is a specific area of questioning regarding emerging roles and new trainings that providers are looking for in terms of their workforce. So that's asked for as part of the Sentinel Network data collection.
Seems to me that the GCACH workforce committee want to look at the question of how the transformation of the workforce, and that's a perspective that none of the providers has. It's only GCACH's workforce committee that has the perspective of what should the workforce, what changes should be made in the workforce, or how should the workforce be transformed. Each of the individual providers can
knows and can speak to direct how they wish their workforce, the workforce of that provider, to be transformed. But only this committee is concerned with workforce transformation per se.
Well, I think one of the things that we would want, well, I guess, does anybody have a response to that? And who was speaking there? I want to make sure.
That was John
Yeah.
Christensen.
Okay, thank you.
So I can respond. I mean, I'm not sure if I'm responding or if I'm complicating. But I don't know. I think that part of what leadership as a whole is trying to do is to describe the future. And from that description, we should be able to draw the information to guide us in this process. But I don't think that we should be going off on our own trying to create a future that's different. I think we should be working with the rest of the ACH groups, taking their and if nobody's really focusing on it right now, maybe we need to remind leadership, hey, let's focus back on this so we can move that way, because we do get sidetracked sometimes when there's specific work and we forget this vision, which I think is really important.
Dan, maybe it would help if if the charge isn't too much different, we can spell out district and articulate that. But I think under the responsibilities, we'll kind of jump to that conclusion in terms of where we should be at. So maybe it'd be helpful to review some of those responsibilities. So
Yeah, okay, go ahead, Carol.
Okay, so I'll go ahead and read some of these bullets. So the first one says, so the Workforce Committee's responsibilities will include the following: reviewing the GCACH provider system, workforce needs, and developing and recommending a target state for their workforce, supporting a gap assessment between the current and target workforce state, addressing the impact of the delivery system reform incentive payments and the specific district projects being implemented on the workforce, developing a workforce transition roadmap and overseeing the implementation of that roadmap, developing a workforce training strategy and overseeing the implementation of that training strategy. I question that one. Monitoring the GCACH's provider workforce performance relative to the workforce transition roadmap and training strategy, and recommending adjustments as needed to address challenges and changes in the market, and collaborating with other project teams and ACH organizations as appropriate.
So reading that, it's the responsibility of the committee to develop a workforce transition roadmap.
That's what it says.
Yeah, that's a pretty big job. Boy. So we do have it. So it is an important purpose.
I mean, this is a
Well,
chart
wait,
that
I'm sorry. Carol, don't you think that the learning collaboratives and what we've been doing is part of that training strategy?
Absolutely, yes.
And perhaps part of that, just articulating that roadmap is including the learning collaboratives as part of that roadmap and the strategy, and articulating that. I mean, it's kind of, we kind of know that this is happening. We just need to document that.
Right. I don't think it's been so long since we've actually looked at this document. I think we're doing a lot of the work. We're doing a lot of this work through the Sentinel Network in terms of the gap analysis. We did the current state assessment last year. That was a tremendous body of work that we learned a lot from, and I sent out the findings of that in the email to the committee. We've been working with Dan Yu and the Health Workforce Council to look at gaps in the whole state in terms of provider and organizational needs. So I think there's a lot of work that's being done. It's just that we haven't really tooted our horn about it yet.
This is Rhonda. I would agree with that. I think a lot of this has been done and is being done. I think the words are different, but I see a lot of this is happening.
So what would you suggest would be, I mean, I guess, you know, we need to kind of finish reviewing this charter and exactly what we're doing. But it sounds to me like there's also room to, I don't know, fine tune or to, to maybe be a little bit more exact about what the focus of the community should be.
So may I make a suggestion, Dan? Why don't I take these bullets and I'll do a crosswalk with what the charter says and some of our current activities so that we can articulate what we think we're doing within each one of these areas. And I can bring that to the board so we can discuss that and the committee can discuss it further so that everybody. And I do see an opportunity to maybe change the verbiage to be more in alignment with what we're already doing. Because I think Rhonda's right, is that we're doing a lot of this work, but we haven't articulated it very precisely because we didn't exactly know what this was going to look like at the very beginning when this was created 2 years ago.
There are also some areas where we may not have paid as close attention and we want to start paying a little more attention to.
And yes, and I think that crosswalk could then be the framework for our transition, you know, our future state.
Yeah, that sounds good.
Sounds like that's an active plan on how to go from where we're now and move it somewhere where we have a productive impact.
So then maybe we could just briefly discuss the composition and whether or not we think that we're meeting the guidelines that we set for ourselves a couple of years ago, which was talking a little bit about the committee will consist between 10 and 20 members, and I think, Lauren, did you say we have 14 on the call right now, or between all of us?
I think there was 10.
Okay, so 10 plus these people here, or
No, 10 total.
Okay, so we have 10 total.
Not including our staff.
I'm not including our staff. And then we have the workforce committee in the second paragraph will include educational institutions, human resource representatives, workforce experts, and frontline staff. And I don't know what exactly frontline staff, how we're supposed to interpret that. Of recruitment and hiring.
Or out actually, you know, perhaps we were pretty short on language pathologists. Maybe a speech language pathologist would be helpful in us designing a way to recruit more speech language. You know what I'm saying?
All right.
SLPs.
All right.
To go back to abbreviations. You know what I'm saying? I think that's what I think of when I think of the front line. The educators and all that, that's the educational institution.
Carol?
Yes, Patrick?
This is Tom Adams.
Hi, Tom. Hey.
Hi. Hey.
Tom's the frontline staff. Okay.
Tom's been listening in the background, yeah. When I think of the group that we want to include in that frontline staff are the supervisors, the direct supervisors. Everyone else feels a little bit distant from where the actual, you know, I think if we're supervising interns, trainees, associates, those folks need to be included in this list of designing the program. Maybe I'm talking off the.
I think that's good. It's just I know that when we're working in schools, sometimes we forget to ask the students to participate in the discussion. So I know that we have all the people that have a lot of knowledge, but sometimes going to the persons who are looking for jobs or something could give us a clue on how we can do better. I'm not saying they have to be on a committee, but I think we need to look beyond what we know now and try and find new solutions.
Yeah, this conversation around who are the best people to be involved with this work is a ongoing and active conversation. Oftentimes we suspect that chief executive officers are not necessarily the best individuals to reach out and to, depending on the organization, ask about their workforce needs. Sometimes they are, sometimes they're not. But oftentimes, it's the managers that, in collaboration with the hiring managers or the parallel HR folks, that are the best people to tell us what their needs are.
I would note, Dr., that this paragraph, the sentence, lists people or types of people that the workforce committee will include. That is not intended to be exclusive. It just says you should have people from these various places, but it doesn't say that there can't be others on the committee. Yeah, I think it's an attempt to say this would be a well-rounded committee. I was just noting the word include. It will include these, so we don't need to be concerned, therefore, that we're excluding people of any kind from the committee.
So if that's the language, and just ask, is there anybody else that we should include that is not in this list that really needs to be at the table on the workforce? What do you think, Dan?
I guess the only thing I'm thinking of is whether or not we need to call out or maybe find the definition of education institutions, because it's such a broad swath there. And maybe we don't. It's just, I think K-12 should be represented. I think the community colleges should be represented. Higher education needs to be represented. Is this something that's important to articulate in this particular section or not?
I don't think that you need to do that today. After all, the first item in this list is educational institutions. They won't be forgotten.
Well, this my opinion. I think one or two educational institutions could very well represent the whole educational institution system if we have good guidance by committee.
Okay, all right. Is there any other comment or suggestions regarding this particular section on composition?
Dan, my question is, how are you defining workforce experts?
Someone who shows up to a meeting and say they're an expert.
I guess I'm an expert.
Oh, that's how I got on this committee. Okay.
Well, it's interesting because, please take this kind of next, expression with a grain of salt. But when I show up to the State of Reform Health Policy Conference, which is a statewide conference, people refer to me as kind of the workforce guy. Does that mean I'm an expert or that I'm just the workforce guy? And so I consider Patrick Jones a workforce expert, but I'm the workforce guy. So, I mean, differentiate that. And
So
I would.
Patrick, he has a much broader view than a lot of localer kinds of people, which gives us a way. I think there are other individuals that work with helping people transition in workforce one way or another that could be considered workforce experts. It makes me think of WorkSource, the state agency. Is that something we need to be somewhat connected with? I'm not sure that that's the direction to go, but I think that making sure we have somebody that has a really good, has a lot of exposure to a very broad WorkSource arena is a good thing. And
both Aisha and I sit on the local workforce council. And so I think Dan is very well connected with their workforce.
He's doing the big state.
And Justin Merrill, I think, also was part of the workforce in Yakima, so that's why he was on this list. And then there's Debbie Spink that runs the DOH Community Health Worker Training. So I think we've got a really broad representation. But so Patrick, were you going to say something about workforce experts?
No, I don't think I mean, you know, what I would have to say is just my own personal thoughts on the composition of the group, but not necessarily any comments from any knowledge I may have or of the labor market. And Aisha certainly is on the line, and she could weigh in as well on the labor market. But you know, I just my thoughts are basically just the composition of the group, and in particular, how fast you need to move on this project, I guess, is one of my concerns, because I think you need to start dispensing the funds in 2020, do you not?
We'd like to dispense them as soon as possible, as soon as we get to the policy. So
I think what we're doing is trying to define things, and we're not saying we're missing something or not missing something. So if these are inclusive enough, then I think we can move forward. And if we want to further describe things in a internal kind of explanation of who we see ourselves as, then that might be a good idea.
I would like to, this is Aisha, I would like to add something quickly. As Patrick and I are very labor market information and expert in that aspect, but since this is a committee for healthcare, from healthcare aspect, having an expert specifically in healthcare workforce development is something that would benefit a lot somebody. And usually that individual comes from the SHS area or credential areas from the state, or educational institutions from their healthcare programs and departments. And that's my opinion on that, because we are working with the healthcare aspect of workforce development.
Makes Dan the expert.
Yeah, I'm locally, I'm fairly connected to nursing workforce development, but this needs to be much broader than that.
So I think we could spend a lot of time talking about this idea of workforce expert. I don't mind fitting the bill for at least a piece of that, but I think I'm also interested in this moving on into the composition section. If you all don't mind, because I think we may be running out of time here. and that is the duration of the term that people serve. Is that something that we need to be? Do we need to change that, or do we need to adjust that to just? Is there a way of just saying that this is kind of an ongoing or open? Anyway, help me out here in terms of understanding the limits on how long you serve.
There's no term limit in that. It just says that year by year it's going to be looked at. It's how I read it. So I'm sure that, like with many of the positions in church, if you say you're going to do it, nobody's going to complain.
Is that clearly understood in that that sentence or that section?
What section were you looking at?
It's paragraph 4. Members workforce will serve 4.
Okay.
I guess, Carol, if that's, oh, go ahead, Wes.
I'm not sure we need a term limit. We'll serve as long as they're contributing and capable. And, you know, I'm not sure there needs to be a term limit. This isn't a board. This is a working committee. There needs to be somewhere in there about the ability for the board to restructure the committee if they see need or something like that.
I agree with you, Les.
So I think, Dan, by the way, we extended this meeting to 12:30, or was it 12:30? Just so that you know. But I think that we can take what we have so far and we'll send it out to the committee members for you guys to comment on and make thoughtful changes, so we're not spending the whole time here talking about just the charter. But clearly there is a need, I think, to revisit, you know, all of the charter. And I guess, Rhonda, the other thing that I would ask you as board chair is whether or not you want the board to officially appoint these members, or if this is just a working committee. And then that would be really helpful for us as staff to be able to take this act.
I think it's a working committee, but I think it's a working committee, and it would be up to you and Dan as the board, as the committee chair, to make sure that we honor the composition.
Okay, so this is a working committee, but it doesn't need appointment by the board. Is that what you're saying?
Yeah, I don't think so. Do you?
But the
No.
paragraph 2 says members of the chair. She's in a different section. So I guess it's 3. Paragraph 3 says appointed by and report to the board or through their representative through the governing body. So if we're not, so the board would need to take action to appoint the responsibility to somebody so that it would cover this. Is that what I'm saying?
Yeah, so do you trust staff and Rhonda to seek out the individuals that should be on the working committee, and then we report our findings to the board as needed? Would that be okay?
Yeah, I sort of read it that way, that I guess the governing body, the board has approved the charter, and we've said that the workforce representative is the chair. And so I would give that to the workforce chair, or the chair and the staff and you to be able to determine the committee.
Okay. So we will take that language and rework it and bring this back.
This is Chuck. I'd like to observe that paragraph 5 in this section addresses the issue about, do we have lots of people on the list who are not actively participating? It's basically saying 3 times and out. I think that, I don't know how recently it's been reviewed, but that may solve some of our problems.
Yeah, and I think what we normally do, Chuck, is when we have members of committees that aren't actively attending, we send out a doodle poll. We say, this is to confirm your interest in this committee. Do you still want to remain on the committee? And they say yes or no. I noticed a couple of people on the roster that no longer, are in service. And so we move those people off of the committee and then confirm the rest, and then bring that back to the board. And just to let them know who is interested in remaining on the committee. So.
It's 75% because we're trying to do consensus building. I've not been in very many things that require 75% for any action to happen. And I hope we don't do things, but 75% is a pretty high line. And I don't think I would like it left there personally.
It's not a 75% approval of an action. It's 75% of the board attending a meeting.
So that's the quorum. The next one says requires approval of 75% of work. What? There's 75% again. So it's got to be 100% of a quorum, if I'm reading it right. You know what I mean? So I think that language might need to just be looked at to be majority or something like that.
We can do that.
Thank you.
Okay, so we'll take all of these comments back and rework the charter and bring it back to the committee. And we'll send it through email for your comments. How's that?
That sounds really good, Carol. Thank you.
All right, thank you.
So are we ready to move on to it looks like we are ready to move on to the scholarship fund.
Warren is. And we've moved.
The work on this is to read the policy and confirm it, or?
So this was staff's initial attempt to try to take all of this information that we have been gathering over the past really year from the Sentinel Network findings, from conversations that Dan has had with particular individuals, and just what we have learned through the Practice Transformation Navigators, looking at the current state assessment, just trying to gather all the data that we could and put together some straw man that this committee could respond to. So we kind of have a background, like we always do of our policies, to say that the board of directors has set aside $490,000, and that workforce development is really part of the Domain 1 activities of Greater Columbia and all ACHs, by the way. In fact, in reading the most recent questions by Myers and Stoffers, they will be asking our provider organizations, what are we doing about workforce and workforce development? So this is a mandate by the Healthcare Authority to address workforce as part of the ACH's work. And so what we have kind of landed on and what we are throwing out there is to use the money for internships and preceptorships. And then Chuck Eaton has reminded us of our conversations that we had early on around community health workers. And I know that Ronnie Batchelor has spoken up many, many times about peer counselors and the need for peer counselors. So we have some ideas out there, but until we have that in writing, it's really hard to move this ball forward. And we want to start sending this money out to our providers as soon as possible. So getting some better definition on the requirements and the description and how much the fund would actually go, how much money we would use per scholarship. It's all out there for your review.
So we're going to time to go ahead.
$490 was taken out of the Behavioral Health Integration Incentive Fund. So that's where those funds came from, because it was identified early on that some of our biggest gaps were in behavioral health, either through clinical training or peer counselors, or does that field seem to be in great need of more, of more workforce?
Oh, God. Okay.
Are we going to take some time just to read through this then, or do you hope people have already read it and now's the time to make comments?
We can go section by section if you like.
So this is a policy designed around a specific funding source. That seems to be a bit restrictive as far as writing a policy goes, but I can see us focusing on that concrete out soon, and then maybe being able to reword things so we can possibly use other funding sources for other things. Making sure I'm down the same.
We just, the board approved at the beginning of the year last budget, and we had identified this money from behavioral health, but that doesn't mean the board wouldn't want to augment it through other district funding. So maybe the first point of contention is to go to the middle of that background where it says GCACH has set aside a scholarship fund of $490,000 out of the Behavioral Health Integration Incentive Fund to help address the shortages of behavioral health staff in our region. This policy lays out the process for providers to access funds for bachelor's and master level students pursuing an education in psychology, early learning, or social work to receive financial support for provider-led internship or preceptorship program. So there is a lot of content in that sentence. There's a lot of assumptions that are made that this is the way that we would organize this work, is that the providers would be the ones receiving the funding, educational institutions, so that they could hire or retain or precept students that are coming into their program. And a little bit of background around that is that the research that we have seen shows that those students that actually intern or precept in a certain location or a certain area, especially in rural areas, are more likely to stay in that region or at that organization. So this is predicated on that philosophy that we are trying to grow our own through internships or preceptorships, especially in the rural areas.
So are there any kind of comments or responses to what has just been stated from Carol?
Word providers is a little, I didn't understand that the way, I didn't understand that to be educational institutions or training providers. But that's what you mean?
No, we're talking about healthcare providers. I should have said healthcare.
Medicaid billing providers.
Oh.
So if you're a doctor and you're seeing
That's how I would normally interpret the word.
Right.
But I guess I misunderstood what Carol said just now. She was basically saying that it's designed to go through a provider, not through an educational. Thank you. I think. Okay.
I'm nodding my head.
This is Chuck. The question that comes to my mind is the educational process that majors in psychology and early learning or in social work, preparing them to provide an integrated behavioral health approach to the delivery of services in the community. And it strikes me that not all majors that of this category do that. So it would be really helpful to have a picture of what the educational process looks like in terms of available institutions where one could go and get this. Also, as somebody who's worked in psychology departments, I would say probably not so much. And so somebody who wants to get their master's in psychology gets an internship, but isn't trained to do what they're supposed to be doing as an intern working with a provider.
I think the question is a really, really good question, and it lends itself to this maybe broader question about what our target audience here is. And when I'm thinking about this, and I've been involved with developing this statement, I'm wondering if we have some flexibility here of including those who are engaged in some kind of human services training, who then work in the broader market of or broader field of addressing social determinants of health as part of kind of integration work. And so I'm wondering, does that make it too complicated here? Or can we make it broader? Because I know there's such a focus on addressing or helping to train folks who are working in the broader human services market, and helping those who are getting into the work, social determinants of health, and integrated behavioral health, and working of course is part of that. So just curious about what folks think about that.
This is Sandra. I think we'd have to be very careful because social determinants of health is very broad and has a lot of interpretations. And so we could be spreading everything out a little too thinly or to things that don't get us the end result that we want. That would be my only concern. Not that I don't think it couldn't be addressed somehow, but I think we need to be very careful when we're walking that line.
Yeah, good point. Thanks.
And the funding comes from behavioral health integration, so it really should go towards helping people, helping us get a workforce that facilitates behavioral health integration. I don't.
Well, is that accurate though? Because it's not. Is the money from behavioral health integration or the change to integrated managed care? Because those are different, aren't they not?
There was a change to integrated managed care, Sandra.
So
the INC funding.
That's where it comes from.
Right. So then we could change that in here from behavioral health integration to integrated managed care.
Yeah.
That would change. That changes a little bit. I was being very restrictive because of that statement.
Right, because I mean, like I said, when the money is coming from integrated managed care, when we look at specialty behavioral health, addressing social determinants of health does make sense and could help improve outcomes. So I wouldn't want to discard it, but that was my point, to just walking the fine line of making sure.
And it's still around the integration process, fairly well described from what I've seen of what's going on. So I think that helps to focus a little bit on who and what would be a good match. But I see early learning and it keeps popping up, and I don't know if I see how early learning is a behavioral health field.
You know, and we confess that we got this idea from Darlene Darnell when we were visiting with Catholic Charities. When we were visiting with Catholic Charities and understood the types of programming that they do with early learning that are a lot of behavioral health. There's a lot of behavioral health that happens with early learning and children, autism spectrum. So that's kind of, I think, where we got some of those ideas. Is that right, Wes?
That sounds right.
Is that there's a lot of work that has to be done with child development and early learning that deals with behavioral health.
Yeah, I think there's a broad early learning, which means getting early education versus the early learning that you're talking about, Carol, that's dedicated to a specific subgroup of children.
So I think that you're talking about child development.
Okay.
And not early learning.
All right.
It's just how I see those. I agree that we need to have well-trained early learning tools. I can see that paying off wonderfully. I just don't see it.
So you're saying childhood development?
Yeah.
Well, the reality is developmental psychology is part of psychology. I mean, and it encapsulates, you know, the developmental psychology or expertise that Darlene's referring to. So, I mean, yeah, so that's.
It's a sub-psychology instead of a separate group.
Okay.
It is.
Development.
So we're not looking at someone who's doing a master's in family and whatever, or any of those other family kinds of things.
Isn't that psychology?
No, in family.
Well, that's a very good point. I mean,
it sounds like a behavioral health discipline.
I just know other counselors. And so are we restricting this because of licensing and payment, or are we trying to be broad enough to capture all the counselors? And I guess maybe MFAM is a psychology something. I've never thought of it that way, but
I think you're bringing up a really good point, and so we should include MFTs or marriage and family therapists and master's level counselors in this. And I think kind of like who is actually certified to provide clinical or counseling services by the state. That's what we should use to guide us here.
Okay. So we can tweak that section and better define the audience that we are trying to attract. And we will, instead of psychology, we'll include developmental psychology. Dan, I'll look to you to find out who is certified to provide counseling services so we can get some of that language. And then, are we okay with social work then? Okay.
one of them.
So where do our chemical dependency providers fit into this?
Good question.
That's right there.
Yeah, it could be a separate. It's been in the past a fairly isolated, separate thing. I would like to see them more integrated.
What about
So we would say substance use disorder treatment.
Yeah. Well, what about just a broad term like counseling? Behavioral health counseling.
This is an issue, and that is that I think the original intent of using the term behavioral health was to promote delivery, integration of mental health and chemical dependency services.
Absolutely.
Right?
Absolutely.
And our state, forgot now which part of the Department of Health, Human Services this falls under, but when they decided that there needed to be integration, what they did was to create a new super commissioner's position, and then put that commissioner over the two existing commissioners for mental health and substance abuse. And there is no interaction in the organizational structure from there. And with that being the state leadership, how educational institutions and licensing organizations work with that is very, very difficult in this state. It's been done very differently in other states, and the professional organizations have addressed this in different ways. So ultimately, we're going to get back to, we're dealing with a system which reimburses for visits to licensed providers. It doesn't reimburse for the management of an individual's health care or for the provision of certain services, no matter what trained person provides those services. And so when is that going to change? We hope very soon, right? So we're in an area where this is of most concern to my set of concerns, because the ability of people to work in the community is not going to be done by the physicians, it's not going to be done by the nurses, it's not going to be done by the social workers, it's going to be done by paraprofessionals who don't have perhaps even a bachelor's level of education. They are experientially trained, or they're trained as community health workers or another description. So this is really the area that I'm very concerned about. What are we preparing the workforce for?
Information to tweak that sentence so it grabs all of the potential that we could get for that area without making it a free-for-all.
Take a stab at it.
This is Aisha. I think to not be very specific on this educational aspect of this, you can always say psychology, the pending review, or you can say human services degrees, the pending review of what they're pursuing of the committee of the board. So you can always be more general where you don't exclude anything that, or you can miss something, but you have psychology could be anything that's so broad under that psychology, and that there's counseling, behavioral, and this and that, marriage, and everything. So just being a little bit more broad that you can be inclusive, depending review by the board might help actually not exclude those individuals who want to pursue this education and get the support from the funding that you're offering.
So maybe one suggestion is, and I think it's a good point, pursuing an education in behavioral health, in parentheses, psychology, developmental psych, social work, human services, marriage and family, counseling. I mean, so if you, or other area.
Applied behavioral health sciences.
Right, or applied behavioral health sciences, right. You, I mean, because, and I think whoever was speaking earlier, you know, because it may include providing funding or support for peers or community health workers or other people that are working in that kind of integrated behavioral health system. everyone pretty much needs hours for some kind of residency, internship, and clinical training. So I think to, again, identify the general area and then give examples of what those areas are may be sufficient.
Okay. That was Dan Ferguson.
Yeah.
That was a good summary, Dan.
Yep.
So could we talk a little bit about this idea of using the provider organizations as the conduit for the funding? Does everybody agree with that? So that the funding wouldn't go through the educational institutions, it would actually funnel through the provider organizations, the ones that would be hiring or precepting or interning or including in their behavioral health integration team those individuals.
Yes.
There's a couple things that I was thinking of on this. The first one is, how do I, as a student, even know that this stuff exists? And how, I mean, is it, as a provider, am I going to want to do this to try and attract students? I mean, somehow there needs to be, I think the entry to it should be both directions. So if I'm a student and I want to do an internship or something, and I'm contacting the provider and they don't know anything about it, maybe that would be a way for them to participate. The other thing you have in there is that provider must already be contracted with the GCACH for purposes of practice transformation. So maybe that's moot because that's a very specific, smaller group of people. But it's not going to give us internships beyond that. I don't know.
On the other hand, those people will be aware of what the goals are of the GCACH and why they're doing what we've got.
Great.
Provide that. I wanted to get involved. Maybe I could contact the GCACH and see how I can get involved.
Well, one of the reasons that prompted this was that when we were looking at our current state assessment gap analysis, there was a tremendous amount of interest from our provider organizations to do internships or preceptorships. So they're interested in doing this. And so rather than try to create too complicated of a system where we have to go out and work with educational institutions and provider organizations, we thought that this might be a way for provider organizations to use the existing relationships that they have with their educational institutions, whether that's a community college or a four-year institution or some other training program. There are a lot of providers that are aware of Greater Columbia because we work with them, and that this is an opportunity for them to access funds to further their staff or their internships or preceptorships. So that's kind of where we took that from, is that there's a lot of interest in this particular fund.
So I guess from other groups I've been working with, there are some providers that have been, they're independent practitioners, and they're really wondering how they're fitting in all this. How are they fitting into transformation? How are they fitting into, and some of them have expressed a willingness to have interns, and have expressed how expensive it is if you're to, that difficulty.
So, what's your name? Les. Yeah. You asked, how will students know that these programs exist? And I think that it might be a good idea to publicize it to the general public and see where that goes. If there's interest on the part of students, then they'll transmit that to education and on to providers, and so that there can be a general awareness of this, and we'll find out who was interested in participating.
I want to ask Rhonda and Sandra how it would be for a provider organization to be reaching out to their educational partners to market this or make those organizations aware of these opportunities for students, how would this be for them?
Well, this is Rhonda. Quite honestly, I think the marketing is more to the provider organizations. The educational institutions are begging for places to put students. In fact, I just had a call from Dr. Lawler yesterday from PNWU that they are forming a relationship with Multicare because they're placing students on the other side of the mountains because they're having such trouble finding placements. So in my mind, the marketing is really for the providers because the students are, we get random calls from students from all over the country looking for placements here. And I'm sure Sandra does too. The students are that's the need, is to find providers that are willing to accept this. And I see this as the incentive for the providers, not incentives for the students or the educational institutions.
This is Sandra. I agree with Rhonda. I mean, it really is about how do you take on more students as an organization, and that's true for, several, especially the FQHCs, at least I know that I've always talked to, how you take on more students, because there is a cost to taking on students and precepting more because you do lose some productivity. So I agree with Rhonda 100% that it really is more marketing for towards the providers to accept students versus to the educational institutions, because they're the ones struggling to place their students.
Right. Yeah, so I appreciate the use of the term incentivize. So I think this is a really, I mean, just being involved in the development of this process, that's really kind of one of the, it's almost like a secondary gain in terms of encouraging provider organizations to be involved with reaching out and encouraging students to come into their organizations for training. So I agree.
Just to address what you earlier asked for, in the policy, it calls out that provider organizations in this program must be under practice transformation. So if an independent, non-contracted provider wanted to participate, they could either enter into the very latest cohort, or unfortunately, they might be excluded.
Yeah, and I know that I've talked to some independent people saying, how am I going to be included in this whole thing?
If you're a Medicaid provider that does primary care, behavioral health, nursing facilities, palliative care, and you're not in the program, I mean, there's an opportunity, but the window is closing.
But do we have to close the window? Couldn't we open it up instead for these funds specifically to achieve our mission?
It's up to you guys. I mean, we just put that in there as how are we going to put parameters around this. We just felt like we already have this relationship established with our provider organizations that are doing practice transformation, which means that they're doing integration, because that's one of the requirements of PCMH, is that you are integrating care, so that there's a relationship between, or a connection between, integrated care and these internship opportunities. So.
And I don't want to discredit that, and I just think there's a way to do more. We don't necessarily have the room to expand our cohorts to accept all of these patients. We do want the folks who are in our cohorts to participate in this, and so this is a great incentive for them, but that doesn't mean, one, that we have the capacity based on who is under contract to really use these monies and expand access like we should. A lot of our organizations do refer to these organizations, to other organizations, because we don't provide services, and we're only going to achieve so much as far as bidirectional integration is concerned during this waiver window, that it might be beneficial to open up access and to see improved outcomes, because this hits a lot of our other outputs and measurements for our Medicaid patient population, like ER diversion and et cetera. So maybe there's a priority ranking system between, we'll give you, and I don't know what we're going to do to determine who does and does not get an incentive under this process, but I think it's worth at least looking at.
So I think we just have a few minutes left. Dan, how do you want to address, I mean, the big question, another big question is the funding and how much is available to each provider organization. So we could spend a lot of time talking about this, but we had no idea of how much to put. It could be anywhere from, you know, $10,000 to $100,000. So it just depends on the committee how much funding they think that we should be allocating to each organization and what our goals are.
Carol, tell me a little bit about the application process for these funds. Is that something that an organization, say for example, either Sandra or Rhonda decided they wanted to apply for these funds, and would they basically state in like an RFP process or a letter of a letter of request? Help me through that a little bit.
The idea would be to go through the provider organization, Stan, and Becky and Wes, you can help me remember what we came up with. But our idea was that the providers would be aware that these internships or preceptorships or these job opportunities are available through Greater Columbia. And it would be the provider organization then that might have been contacted by students or an educational institution to say, oh, we have, you know, 2 or 3 students that we would like to precept, or 1 student, and then the provider organization would apply for these funds through Greater Columbia. So we would work directly with the providers and not through the educational institutions. Do I have that right, Wes?
Yeah, and likely there's an application process that would go along with it, but it would be in that manner.
This is Patrick. I've just got a question for Rhonda and Sandra. What's a ballpark number for your organizations to trade off the loss of productivity that inevitably comes when preceptorships or internships with the opportunity to accept these students? Do you folks have some thoughts on that? I don't know. I don't even have a ballpark idea.
This is Rhonda. I would have to spend some time calculating it. I guess my thought was, we have a budget and funds flow committee. Is this a question that would be appropriate for them to kind of put a formula together? They've done well with other things.
I think we'd actually like to have some numbers, Rhonda, from provider organizations. I don't know that the budget and funds flow committee would actually understand what it would take to precept somebody. I think it's been a stumbling block for a lot of decision making on our side that we just don't have a number we're working with. In talking with somebody recently, they thought it would take $100,000 to precept, you know, somebody coming into their program. So that doesn't leave a lot of room for a lot of.
Yeah, I think the hard question. Well, you know, what I would look at would be, you know, I think we would say it would be like something like a provider sees a third fewer patients when they've got a precepted student. But the question would be, what's the length of the precepting? Because different programs last different lengths of time. And so it would depend on the length of time that the number of hours the student was here. And so I guess that would be, that would be the thing that I would look at. And so we could calculate it based on that, but it would depend on the length of time, the number of hours that each student and each program is different.
And I would want to caution us against a true kind of I don't know, reimbursement model where in this situation there's lots of ways of kind of addressing return on investment for the organization. And so I think we want to be a little cautious about just coming up with just a true number for the cost to the organization. I mean, I would think, because I'm not sure that I mean, like your first example, Carol, was it would cost $100,000. Well, yeah, thanks a lot. You know, I mean, what's your vested interest in developing your workforce for the future? Anyways, I'm being a little facetious, but I think this is an important consideration.
So the idea is not to pay for the internship, it's to offset some of the burden of having an intern.
Right. So I was thinking about the communications committee when we have people apply for us to sponsor an event for them. We don't tell them how much they can get. They ask for us to sponsor a certain dollar amount. So like what Les was just saying, we may not know what it takes to offset the cost of a provider to have a student in their business. So they would come to us and say, look, I need $20,000 to pre-sell the student in my offset. So turn it around to that instead of.
But there should be some, I still think there should be some, I mean, like, I have a lot of things where you have to have your in-kind. You know, we'll give you this much as long as you show me that you're giving this much. In other words, I'm not going to pay for all of it for you. You have to be investing in this before I'll give you something. So if it's going to cost you $20,000, we'll give you 10. I don't know. Right. You understand what I'm saying? Yeah. Some way to, but then I'll just ask for 40.
Or the application process has a budget, and so we see what we're putting that money. If they ask $20,000, and going to the student, and then going to the provider office to make that time they're spending with the student, and through looking at both those things, or just one of those things.
I don't think we'll ever be able to pay for the complete cost of this program. So I think if we on that, we're going to get into problems.
I mean, one option is to come up with I mean, let's figure. We need to look at what do we have as data points and come up with a cost and a flat rate, and providers will either accept that rate or not, because the bottom line is we're all taking students without any funding as it is. So I think rather than get too deep with it, trying to cover all the costs and figure all this out and having people put together a budget, that might be creating a lot of work. Whereas if you said, hey, you get X amount for this type of internship, X amount for this type, and X amount for this type, based on how long those requirements are, as Rhonda pointed out, then you see who jumps and who doesn't.
That's a good idea.
Well, I think we're a little bit over time. You've given staff a lot of really great content and feedback on our first attempt at this policy. We got a lot further than I thought we were going to. So for that, we're really grateful. We will come back very soon with another draft, and we'll try to meet, if possible, within the month, just to get this off the dime, because I would like to start this in 2020 if we can, or as soon as possible. So we'll do some homework. We'll send you guys out a different draft. But thanks everybody for your really thoughtful input and comments. It's been great.
Yes, thank you for this. Good work today. Thank you.
Thank you.
Thanks, Dan.
So if I'm doing something in education, I had, if it was a quarter class and I was doing a lab, or they were doing a clinical, it's 3 hours per hour. So a quarter class is 10 weeks, so that's 30 hours. If I was working in a semester situation, they go 15 weeks. So then it's 1.5 kind of thing. But once you're out of school, it's a flat number of hours. You have to do an X number of hours of this and X number of hours of that. So you have here some things about paying up by quarter or whatever. Right. That would probably need to be scaled to some way to show that this is a 3-credit thing if we're doing it by that educational thing, or do it by hours in some way.